Thanks everybody for coming. And I'm going to start by saying there is no more important issue in American life than access to good quality, affordable health care. And the reason that's the case is if you and your loved ones don't have your health, everything else goes by the board. You can't work, you can't have fun with relatives, you're not around for a walk in the park, everything else goes by the board. So that's what brings us together, is that kind of glue that ensures that Americans have access to something as fundamental as American health care. We have been trying for months now to get the Republicans to negotiate with us, Republicans on the Hill, Republicans in the White House, and they have studiously ignored the needs of more than 20 million Americans who are just right now about to get hit with a healthcare wrecking ball, huge increases in their costs. And I have a couple in Eugene, Oregon. They're not quite eligible for Medicare. They are facing a 500% increase in their premium compared to what they spent last year. 500% for essentially the same care. And Republicans are just not stepping up. And we have been working to debate different approaches and solutions. Basically, what we've gotten is crickets. Now, Peter is a very valuable member of the Finance Committee, and the reality is the Republicans have basically just been sitting it out, literally sitting it out. It has been 400 days, premiums of 500% increases, and still nothing moves them. I guess sending beef to Argentina or something might be of interest. It hurts our ranchers, but that's not doing what we needed. And the reality is this constitutes dereliction of duty in public service. That is the only way I can describe it. More than half the country has received zero notice from insurance companies that their premiums are about to spike. So the private sector is sitting this out. You've got senators sitting it out. You've got the private sector sitting it out. And people, we're going to hear it because we'll be home here in the next couple of days. People are so concerned that they just have no extra room to pay for their necessities. They're not going to be able to make rent. They're not going to pay for groceries. They're going to have problems paying for energy. This is what's going to happen when the healthcare wrecking ball comes. So thank you all for coming. Protect Our Care has always been a juggernaut for citizen involvement. We've been so glad to work closely with you. And I promised that I wouldn't give a filibuster. And I'm going to let my colleague, Senator Welch, take up where we are. But thank you for coming. This is it. We have worked for months for this particular day to drive home how important this is. We're going to stay at it until people get some relief. Senator Welch.
Thank you so much, Senator Wyden. And you said it. I mean, this is healthcare that absolutely matters to every single American. And what is sad for me, aside from not having any engagement by the president and my Republican colleagues, is that what we're trying to do is help folks have some healthcare security, whether they voted for Trump or they didn't. This is not a red state, blue state deal. This is not a Republican Democratic deal. This is about families. It's about small businesses. It's about farmers wanting to have some minimal level of confidence that if they get sick, they'll be able to get care. If they get sick, they won't go broke. And we've got a bad healthcare system in this country. A lot of places you can get the best quality care, but we spend the most and get the least. And this will make what is already an expensive system, in a creaking system, much worse. Cutting out all those folks who are on Medicaid, that suggests that the approach we have to cost cutting in healthcare is to cut people off of healthcare. Newsflash, people who don't have healthcare still get sick. And I just want to put in context what this means to some real Vermont families, okay? We have very high healthcare costs in Vermont. And we're going to have 45,000 Vermonters who will lose health care if we don't have these tax credits extended. And keep in mind, these are folks who are paying for their own health care. We have a family, 60-year-old couple that earn $82,000 a year. Their premiums would increase by $23,000 a year. By the way, that's before you get into the copay and the deductible. A family of four that earns $129,000, that's a really good income in Vermont, by the way. But you've got a couple of kids, big expenses. Their annual premium would increase, hold on to your seat, by $50,000. Okay? So you know what the answer is for that family. No insurance. And can you imagine, we had a mom who was saying that she feels totally irresponsible if she doesn't have health care for her kids. But on the other hand, she's financially unable to provide it. Another family of four earning $64,000, ages 45, and two kids, 15 and 10. Their premium increases are going to go up $2,500. This is unnecessary. And all we have to do is sit down. And when Senator Wyden and I talk to many of our Republican colleagues and ask them, what about those families in your state? They are candid. That'll kill them. They know it. But they won't talk with Senator Wyden, our leader on finance, unless they get a permission slip from the president. So, Mr. President, make a call from Asia and let these guys loose so they can negotiate with Senator Wyden, and we'll get this done. Thank you.
And Senator Welch, a very valuable member of the negotiating squad. Let's go with Stephanie next and then Ann.
I used to keep these on top of my head, but then they got caught. So I want to point out that was smoother. Good afternoon. My name is Stephanie Bradford. I currently live in Lancaster, Pennsylvania. That's a small city surrounded by a lot of rural and agriculture. I'm a writer. I'm also a type 1 insulin-dependent diabetic. Thank you for making the time for this conversation. I've been asked to speak about how the expiration of the current ACA tax credits will affect me. And in order for you to understand that, I need to give you a little bit of background. I'll try to be brief. As I said, I'm a type 1 insulin-dependent diabetic. I was diagnosed in 1976 at the age of 7 while my father was stationed at the Naval Postgraduate School in Monterey, California. He was a career Air Force officer. He flew B-52 bombers in Vietnam. I am a genuine military brat. My mother was a teacher. After diagnosis, I spent 2 weeks in the hospital at Fort Ord. I had 57 blood tests during those 2 weeks because the technology then wasn't what it is now. I told you I might go off script. When I was diagnosed with type 1 diabetes, it was considered a chronic disease, which it is, that would probably either kill you or leave you seriously debilitated after 20 years. I have fought hard my whole life to make sure that didn't and won't happen. It's been 49 years since I was diagnosed. I'd say I'm doing pretty good. Type 1 diabetes cannot be managed with lifestyle changes or pills. It requires insulin and continuous monitoring of blood sugars. In our country, accessing these basic life-sustaining, life-saving medications and medical devices requires insurance. I cannot go without health insurance in this country. It's just not an option. In April, through the ACA, which in Pennsylvania is called Penny, I went on a Highmark plan. It had a monthly premium of $637.70, which was with tax credits of $394. I was working at a small branding agency in Lancaster at the time. They didn't offer health insurance, so Penny system for me. At that time, the premium alone was 16% of my take-home pay, so 16%. My position was eliminated at the end of August. I'm now working as a freelance writer and a marketing professional. So that plan has been lowered, as called for in the code. It's $508, and that's with tax credits of $524. In addition, I have monthly copays, though. and out-of-pocket costs that average $308. So that's $816.14 to get out of bed every morning and stay alive. It's not a metaphor, literally, to get out of bed and stay alive and move through my day. That doesn't count doctor's visits or labs or dealing with a detached tendon on my finger, which I had to do last year. 0 out of 5 stars, do not recommend. As I mentioned, I'm freelancing, I'm job hunting, and while I do that, I'm tapping into my small hard-earned savings account to cover my monthly expenses. All I have from my insurance company and the penny system at this point is a letter stating that tax credits are expected to expire and my monthly premiums will go up in January. The predictions in Pennsylvania is that premiums will probably at least double, which means that my out-of-pocket each month for my premium will be $1,016. When you add the other mandatory out-of-pocket costs for insulin, for blood testing, so that I can give the correct amount of insulin, I'm looking at $1,324 just to stay alive. I had several different ways I was going to close this, but I'm going to go with my latest version. Again, I'm an editor, writer. I'm asking my government to extend these tax credits for me and for millions of other Americans. We have an astonishing country, an amazing country. I have lived and traveled all over it. I spent 3 months road tripping about 18 months ago. It's astonishing. I understand that these tax credits are an investment, but I believe that I and millions of others like me are worth it. Thank you.
Stephanie's request should be answered, and you bet she is worth every penny. Ann.
Thank you. Thank you, Senator Wyden and Senator Welch, for your strong leadership and for being healthcare champions for the American people. And thank you to Stephanie, who traveled here today to tell her story, but she's representing millions of people across the country just like her. My name is Ann Schaup with Protect Our Care, and I'll be brief, but I just want to talk a little bit about what we've been seeing, since the start of this crisis and what we're hearing from people these past couple of weeks. We're here today because we're in the midst of a GOP healthcare crisis. Donald Trump and congressional Republicans made the largest healthcare cuts in American history, all to give massive tax breaks to billionaires and big corporations. And now they're holding the government hostage to rip away tax credits from hardworking families. Costs are skyrocketing, hospitals are shuttering, and our nation's public health infrastructure has been gutted. Starting this Saturday, when open enrollment begins, millions of Americans will log on to sign up for coverage only to find their premiums have skyrocketed, doubling, sometimes tripling. As families weigh their options amid this sticker shock, they're going to wonder how they can possibly make ends meet. Because when Republicans shut down the government to end tax credits for over 20 million Americans who rely on them, they weren't just, targeting a policy. They were targeting people. Families, seniors, small business owners, farmers, and people with chronic conditions. But you won't hear Donald Trump or Speaker Johnson talk about the people. You won't hear them talk about Sue, the 60-year-old substitute teacher in Tampa who doesn't know if she'll be able to afford coverage, not only for herself, but for her son who's making his way through school. You won't hear them talk about Jody, an Atlanta resident who is rushing to have surgery before the end of the year because she doesn't know if she can afford insurance next year. You won't hear them talk about Lester, who owns a soul food restaurant in Richmond, Virginia, and is able to afford tax credits for able to afford insurance for his family through tax credits, but also his employees at the restaurant are able to afford health care using the tax credits as well. You won't hear them talk about people like Stephanie. This is a crisis of the Republicans' own making. It's time for them to stop the chaos, fix this healthcare mess, and end the shutdown. And again, thank you so much for having me today, and thank you to Senator Wyden and Senator Welch for their leadership on this issue. Thank you.
Well said, Ann. Let's throw it open to questions. Softball questions can be directed at me. Anything difficult to my friends, but we're available if you choose to ask a question. What publication are you in? We read tax notes. Yeah.
Better get up here.
what we're going to do as Democrats in the United States Senate is every single day, every one, we are going to be working to help people get a fair shake as quickly as possible. Obviously, Republicans have dug America into a hole. Let me mention something that just kind of illustrates it. So we look at their ideas on the Senate Finance Committee, Senator Welch and I do. They were interested in fighting fraud. We said, okay, there's not as much fraud as they say there is, but certainly there's some. We wrote a bill that throws the book at the fraudsters. You know, if you're ripping people off and illegally signing them up and the like, Senator Welch and I want to throw the book at them. Guess how many Republican sponsors we have on our bill about something they said they wanted to do. So I wrote a book about this, and I said, I'll write something that says I'll work with anybody, blue, red, in between, who's got a good idea that wants to help people. So what we're all about is every single day until this gets resolved, we're working to try to get relief to people. And by the way, when we get this done, I've got the tools in place for the next step, which is driving down costs. This year in America, we're going to spend $4 trillion. There's 330 million of us. That's a lot of money. So we're going to work to get out of this pickle that we have been presented with by the Republicans who have not wanted to work with us on fraud or anything else. And the second one we do, I'm ready to go with a new set of tools to fight costs, which I think all sides now understand how serious it is. I think probably Senator Welch wants to add something.
No, I just want to redouble my emphasis on the cost side. We understand, Democrats, that cost is a real threat to access. So, you know, this is the part that gives me some heartache, actually, because our Republican colleagues talk about waste, fraud, and abuse. They talk about cost. We're ready. But the policies they pursue to bring down cost are essentially to take people off of health care. And that's not a way to control cost. So I really appreciate your leadership and emphasis on cost. And come on down, I say to my Republican colleagues.
Okay, we're going to stick around, and we really appreciate everybody's leadership and people who have separate questions and things like that. The four of us will be available, but this is a big day because it all really kicks into action. I'm getting ready to fly. God only knows how many hours both ways. I envy Peter's flight to Vermont as opposed to ours, but we're in this fight. That's the answer to your question. Every single day until it gets resolved.
Thank you, Ron.
Thank you.
Thank you very much. Thank you.
Thank you.
Yeah.
Good to see you again.
Yeah.
My hands are freezing.
So nice meeting you.